Welcome to this video where we tackle the question, why is there so much effort globally to update import policies and control systems? Countries are all at different levels of volumes of import and exports of food, but what is common for all of us is that there is a lot more international trade now, and it is likely to continue to grow. Of course, we want to ensure that the food we offer our consumers through imports offers the same level of safety as the food we produce domestically. No country has enough staff or enough resources to just go around the world, travel to every field, and look at each processing plant. So we had to look for effective and efficient ways to ensure safety, and this is really what the modern import policies and control systems strive for. We have seen great changes in how we handle import and exports in the last 2 to 3 decades, initially simply because we could no longer handle the volumes using the old ways. The focus then moved to doing it more effectively in ways that would make the best use of our limited resources. This is where risk-based processes and decisions really got designed and deployed. As an example of how these systems develop, we can look at our most recent broad reform in the United States. It was requested by our elected officials, the Congress of the United States, who mandated the Food and Drug Administration to modernize the way the agency ensured the safety of the food supply through the Food Safety Modernization Act, which was signed into law in 2011. FSMA, as we read the acronym, targeted both domestic and imported foods, but it was the import controls that really needed the most updating. I invited Mr. Dominic Veneziano and Dr. Andrew Stevens for a quick conversation about this sweeping change. Dominic Veneziano was the director of FDA's Division of Import Operations at the time of FSMA, and he played a leadership role in the design of the rules needed for the implementation of FSMA. He now provides consulting services about import systems and requirements through his firm, Veneziano Consulting. Andrew Stevens is with the U.S. Department of Agriculture's Foreign Agriculture Service and was at the FDA during FSMA's implementation in the Center for Food Safety and Applied Nutrition's Office of International Programs. Their bios are available in the training platform. It was clear that modernization of our import policies was needed. As a laboratory person myself, I can tell you that we cannot handle the number of samples that would be required to get a statistically relevant view of our import products. Dominic, can you tell us a little bit about your role and the drivers for that change from the FDA's point of view?
I was fortunate enough to be the director of FDA's import operations for the Office of Regulatory Affairs for approximately over 10 years. And in that role, one of my responsibilities was to take a look at the regulations associated with imported products and to help facilitate trade.
And what drove the FDA to implement such big changes?
We see 45 million lines of products coming through that FDA regulates. That is a daunting number. We started back in the early 90s with 1 million. So we didn't need an IT system, right? You can manage all of those lines and get it done all through paper and so forth.
Andrew, facilitating trade is not only economically beneficial for our consumers, it's also an obligation that we have, isn't it?
Food safety control systems for imports can be applied in fulfillment of WTO members' commitments in the Trade Facilitation Agreement. Modern systems-based and risk-based approaches to SPS import controls enable fast and efficient importation of safe food while freeing up resources to target high-risk imports.
You can't be successful in protecting public health with the number of entries and number of shipments and the number of products that FDA regulated without also facilitating trade.
I presented FSMA as a trigger of change, but really it was a trigger to adapt regulations to the changes that had been going on for many years. This reminded me, Dominic, mentioning to me one time that as an investigator growing into the import arena, he'd started asking himself some questions. Dominic, what was that question you started asking?
Why am I just looking at imports? Why am I just looking at products at entry? Why aren't you looking at it downstream? What was the compliance of it at the manufacturing site? Were they in compliance? And where did it go afterwards? And what was being done with it? When we created FSMA and we looked at it more of a systems approach in a holistic view of the entire supply chain or life cycle, or call it what you will, whether it's farm to fork or life cycle or systems approach. It has to start from manufacturing through the import process to the consumer, looking at each stage along the way.
This figure from the FAO Manual on Risk-Based Import Food Control illustrates a simplified control framework. We see on the left that we take into account the different types of food products and where they come from. Then we have the prevention step of our national system, or the pre-border controls. While they are described in our national systems, these include the results of processes put in place by the exporting country's food safety authorities and actions by the farmers, processors, importers, and transporters, which all contribute to meet our safety requirements. Then we proceed to border controls, where we verify that proper guarantees of all these pre-border efforts are available, and in some cases we may verify that all this work actually achieved the intended outcome of meeting our requirements. This is the examination part, or what used to be our first contact with the imported product. Finally, we have some post-border control activities, such as monitoring activities, that provide additional checks that the safety outcome is achieved and the goal of protecting public health is met. This second schematic from the FAO manual shows some of the tools that help achieve the objectives of each step. We see components such as an export recognition arrangement, supplier verification, food safety management systems, and we're thinking here of GAPS and GMPs and HACCP, for example. There's information exchange and importer education. These are all examples of the new tools we have to make decisions, while product certification, border inspection, sampling, and testing came from our old toolbox.
2005, I became the director of FDA's Import Operations Program, overseeing all of import operations, looking at the 320 port of entries, having responsibility of about 1,000 investigators out in the field collecting samples and looking at products as they come into the country. I was responsible at that time for looking at regulations and improving imports. And one of the things that I did under that program is create new IT systems. It was early on that we realized that we couldn't manage everything the way the current paradigm was working. So we created a system called Predict, which looked at all the entries coming in. It targeted based upon certain algorithms that we wrote up, and it was all based upon risk, and therefore helping trade facilitation.
Overall, the risk-based system-wide approach is working out very well, as it bridges our SPS and trade facilitation objectives. We've been working with our trade partners for a long time, which really helps us understand each other, and I think this is in part why actually formalizing a modern border control system worked so well for the FDA. When you understand the reality, or the realities, I should say, as we deal with so many different trade partners, with industries, farmers, processors, then you are able to establish systems and processes that are realistic, meaning that they're based on what can and cannot be achieved individually or through partnerships and through information sharing. This phrase from the FAO manual, which reads, "This FAO manual on risk-based imported food control aims to support competent authorities in improving the effectiveness of the control measures they are overseeing based on an analysis of their specific country's situation. This sentence nicely sums up why the manual itself was put together, but more broadly, it sums up what we're trying to achieve, and it is to enable our competent authorities to best protect public health by studying our country's situation and resources, and by effectively leveraging all that is available to us to achieve this objective. We learn about our counterparts' work by industry, by farmers, even the work of private partners who are better equipped to achieve certain objectives than we are as regulators. And through this collection of efforts, we trace a path that works for us to provide safe food to our people. Let's not forget that we are not going at it alone. We work through Codex to gather the best information available and design policy options and control systems, as stated in the Manual for Risk-Based Imported Food Control, by reducing inspection of low-risk shipments and allowing more time to inspect high-risk shipments. Applying risk-based import inspection procedures to imported foods and agricultural products can provide greater assurances of food safety while facilitating trade. And we all benefit from that.